Hi everyone, I'm Camellia, an APRN, a psychiatric mental health nurse practitioner, a nurse enthusiast, and coach. And I wanted to get on here today and answer a couple of questions that I get often. And those questions have to do with my role as a psychiatric mental health nurse practitioner, or PMHNP. So first of all, those questions usually look like or sound like, what do you do every day and what can you do every day? And so I really wanted to just answer those directly. Sometimes that comes from patients, sometimes it's nursing students, sometimes it's nurses that are looking to pursue this route or are considering this route and need more information. So really, I just want to kind of lay things out today and explain this in a little more detail. So the what can you do and the what do you do can be very different things dependent upon state regulations and also your setting. So I'll do another video about setting and kind of where can you work as a PMHNP. But for the purposes of this video, I just want to focus more in on what you can do and explain a little bit more about what I do every day. So as a PMHNP, I can, in the state of North Carolina, diagnose, I can assess, evaluate, I can interpret diagnostic testing and lab results. I can formulate and prescribe a treatment plan. I can also provide psychotherapy, and I can also prescribe medications. And a lot of the role as an APRN includes patient care coordination. It includes health promotion. It includes health prevention. And a lot of it also includes consultation and education. That's a huge part of what I can do as a PMHNP. I can provide emergency services. A part of the role includes psychosocial and physical assessment and treatment. It also includes differentiating between medical and psychiatric conditions. And again, it includes focusing when warranted on medication management and prescribing medications. I actually can see patients through the lifespan. So usually that looks like age 6 through geriatric patients. My program prepared me for seeing patients across the lifespan. There are programs that only prepare for being an adult PMHNP or seeing adult patients. But I can see children, I can see adults, and I can also see geriatric patients. And again, that's based on kind of regulations around your state in preparation for with your program. The PMHNP is certified through the ANCC, which is the American Nurses Credentialing Center. So we are board certified. And typically, when we are seeing patients across the lifespan, we are treating and we can treat patients with a psychiatric or what would be deemed as a mental health condition. So there's an array of conditions and diagnoses from a psychiatry perspective. But from diagnosis, what I do is prescribe treatment plans for patients that usually include psychotherapy and or medication management for those patients. And of course, evaluating and assessing those patients, over time. A huge part of the role includes care coordination, so coordinating with other members of the team. What we know is, of course, mental health is tied to many different things, such as life stressors. So a huge piece of it includes working with team members like social workers, working with team members such as medical providers. And that's where the differentiation between medical diagnosis and psychiatric diagnosis comes in. So we are a team, we are a part of a huge team. And so what I do every day versus what I can do every day, most of that is the same for me. But I actually work in a wellness center where I am one arm of treatment for patients. So my arm, of course, is mental health. But I treat patients across the lifespan ages 14 and up, and I focus in on psychiatric and mental health, and I would even term this as emotional health conditions for patients. So I do provide psychotherapy for patients. I also provide medication management when warranted, and I'm a huge part of a bigger team, of course, where we provide from a holistic perspective. We focus in on spiritual care as well as physical care. I also work in the emergency department as needed. So some of my role includes emergency services, where the role looks quite different. So the what do I do is a little different there. I'm actually seeing patients across the lifespan. For our hospital setting in the emergency room, we see patients as early as age 6. It's not a common thing, but we also see patients through geriatric age. So we've seen patients, of course, in their upper 80s. But really my focus there is stabilization and monitoring. So in many cases, what I am doing is getting a clear assessment and evaluation of the patient. I'm also working with a larger team. That teamwork never goes away. It's very, very important in the emergency department, where we're working with social work. We're working with medical providers in the emergency room. We're working with what we call peer support specialists if the patient has a substance use concern. It's really a big team that we work together to provide the best treatment for the patient. But my role is usually deciding, based on evaluation and assessment and other, information from the team, on whether the patient needs to be observed a little longer, whether they can be discharged safely to go home with outpatient resources, whether they need to be in a program that bridges them between the hospital and outpatient resources, such as a partial hospitalization program, or whether the patient needs to actually go up to a unit and be monitored more closely and over more time. So that's what I do as a psychiatric mental health nurse practitioner in an ED setting. I'm going to do another video to talk about the settings that you can work in. But I wanted to get on to answer those two questions. If I can explore further with you, if you are considering this role or pursuing a PMHNP certification, or you have more questions that you want to kind of pick my brain about, I'm definitely open to do that. Just send me a direct message and/or comment below, and we can talk further. But I'm hopeful this was helpful for someone, maybe that you needed clarification, or that you just wanted more information. But let me hear from you guys, and have a great day.